Look to your left and look to your right. This will be the last time we are all in the same room together. Faith is taking the first step even when you do not see the whole staircase. Dr. Martin Luther King Jr. Metaphorically speaking, the unknown path in which the staircase leads is symbolic for nursing school. Let's face it, none of us knew what we were getting ourselves into. Each one of us carried faith, courage, and determination, as it takes all of these to reach the apex of our goal, a nursing school graduate. What makes up a student nurse? 20% highlighting, 30% ATI, 50% stress, 60% reading, 80% studying, 60% tests, and 100% understanding and application. That equals 400%. I never said I was a mathematician, but I did say I am a nurse. Late nights of studying, early mornings of studying, mid-afternoon of, you guessed it, study. Stress, anxiety, and exhaustion are the chief complaints of a nursing student. Administer lorazepam, PRN for anxiety and insomnia, 650 milligrams of acetaminophen for headaches, and Starbucks IV. Remember the test? Of course, who could forget? It's only been 35 days, 840 hours, and 50,400 minutes since our last exam. Our entire lives we were taught that there is a right or wrong answer, and then you have nursing school tests in which, yes, your answer is correct, but it's not the most correct. Okay, well, can I have at least half of a point, if not most of it? The hardest material on Earth is a substance called wurtzite boron nitride. The hardest substance in the human body is enamel. I would like to challenge both of these and conclude that Dr. Vittori's tests are harder than both of these materials combined. Chief complaint, headache, confusion, nausea, decreased mental abilities, diagnosis, increased intracranial pressure, secondary to information overload. Administer the osmotic diuretic mannitol and Zofran for nausea. We belong to a profession where empathy, compassion, teamwork, problem solving, and most of all, knowledge are all key components. After all, we didn't just study to pass a test, we studied to save lives. When we all started, we had different backgrounds, cultures, and interests. Now we all share one thing in common. By title, we are nurses. By diploma, we are nurses. And soon, by the state of Ohio, we will be recognized as nurses. But overall, within our hearts, we are nurses. You can best hear this at the mid-clavicular, fifth space intercostal. If you hear anything else, please see your cardiologist. Unfortunately, we will not get the free burrito from Chipotle during Nurses Week this year. I don't know about you guys, but my mind operates only as a nurse now. Let me give you an example. The acronym LOL is better known as Laugh Out Loud. In the digital world, but to me, as I'm scrolling on Facebook, all I can think of, where's the prefix to this beta blocker that is followed by my mind then goes beta blocker, hypertension, heart failure, AFib, atenolol, metoprolol, propranolol, and the eye drops timolol. Side effects, xerostomia, bradycardia, peripheral edema. Whatever was funny, I missed it because I was too busy assessing the situation. What makes up a nurse? Funny you should ask. 75% assessment, 60% diagnosing, 83% planning, 90% implementing, 79% evaluating, and 100% dedication. That's 487%. Hey, I never said I was good at math, but I did say I am a nurse. Chief complaint of a nurse, everything. Since there is no cure for those of us who have the calling, treat with ETOH, QID, PRN, PO daily, of course after your shift. My wish for the class of 2018 is to never lose sight of why we decided to become a nurse, and that is to care for humanity free of judgment, to be an advocate for your patients, and to always ask them if they are allergic to shellfish or iodine. Before I conclude my speech, I have one question to ask. What are you? A nurse, B, a companion, C, an advocate, or D, a healer? Select all that apply.